Public Health Director for Josephine County. With me today is Dr. David Candelaria, Public Health Officer for Josephine County. We're holding this press conference today to announce that Josephine County has had its first COVID-19 related death. The individual was an 81-year-old male who passed away last night, April 10th, at Rogue Regional Medical Center. They conducted a test on March 24th and reported positive March 27th. At that time, public health personnel began working with the family and have continued to work with the family throughout this period of time. They've reached out to all individuals known to be exposed and have been working with the family and those individuals to try and keep them safe. At this time, we'll take a couple brief questions before Dr. Candelaria provides his information. Yes, sir. You know what?
Did the patient have
Dr. Candelaria?
pre-existing conditions?
I'm going to let Dr. Candelaria answer that.
Hello, question was, were there comorbidities? Yes, there were. Yes.
Do we have numbers on recoveries in the Josephine County?
Anthony, do you know off the top of your head how many recoveries? 4 recovered.
Any other questions?
Was the patient initially admitted into Rogue Regional Medical Center, or did they first, were they first admitted at Three Rivers? Can you say?
The patient initially was admitted through Three Rivers and ultimately transferred to Rogue Regional Medical Center.
Was anybody else in contact with him? Have they come down with the coronavirus?
The patient and his family were symptomatic prior to their testing and engaged in self-isolation prior to testing and subsequently. This was believed to be community transmission.
But the rest of the family, they're doing okay? Are they recovering?
The remainder of the family's condition appears to be improving.
We kind of talked about this at the last press conference, but with this being the first death, what do you want the community to know moving forward?
I would like the community to continue to be mindful of physical distancing as a way to reduce the risk of contracting this condition. This fatality is a reminder that while some people have relatively mild courses, others it can be fatal, and currently we don't have a good way to predict who will have a mild case and who will not.
At this time, are there any more serious cases within Grants Pass that, or within Josephine County that you're tracking that have progressed to a serious condition?
I don't.
Would you like me to answer?
Yeah.
All individuals that have tested positive are continuing to be tracked, and our public health staff continue to reach out with them until they have reached the point of being recovered, which again is 4 individuals at this time. Although we can't give out the specifics as to what their exact state is, we are continuing to work with them and any other individuals that may have been exposed.
So continuing a process of backtracking those individuals?
Yes.
Still underway?
Yes, it's referred to as the case investigation.
Is this still kind of like what we were talking about at the last press conference with the first case in Josephine County? Do you still not count casual contact as something, like someone you would contact, like we were talking about, you know, people you work with, people you live with, obviously those people you would contact immediately, but casual contact, like people, employees at a store if they went to, or a bank, they are not included, correct?
No, casual contact is not something that we're tracking at this time. It's not something that we've seen as resulting in high risk.
Can you elaborate any more on the pre-existing conditions this guy had? Is it, you know, what kind of general medical issues there were there?
No, at this time, the only information that's being released from the state, Oregon Health Authority, sets the standard for what level of information we release. And so all we're releasing at this time is that there were comorbidities in place. Yes, sir.
Can you say when the patient was transferred from Three Rivers to Rogue Regional Medical Center? And can you say whether he's the only one that's been brought to Rogue Regional Medical Center?
Dr. Candelaria?
I don't know that the details of this patient's transfers through the Asante system are pertinent or required for the fundamental purpose of this message, which is to acknowledge the fatality.
Do you have any other questions? Are any of the 4 recovered patients, are they still being hospitalized, or have they been sent home?
Patients who are recovered,
Who have recovered from the coronavirus, are they still in the hospital, or have they been sent home?
patients who've recovered from coronavirus are not in the hospital. Majority. True, most positives self-isolate. Most cases are not hospitalized.
Do you have any other questions?
All right. We have been working closely with the family, and we will continue to do so. The family has asked that they be given their privacy in this difficult time, and to allow them time to grieve and to reach out to friends and loved ones prior to anyone trying to engage with them. And we'd appreciate any efforts, media and others, to please respect that privacy. Thank you very much.
Is he a Grants Pass man, or is he, you know, out in the county?
We're only releasing Josephine County.
How are medical professionals, or how's Josephine County health professionals working to mitigate the exposure of medical workers that have been working with COVID-19 patients?
The biggest effort by local healthcare professionals to mitigate the risk of exposure for coronavirus has been to move towards telemedicine. They've been screening patients by telephone initially. Patients have been asked to call first before they present, especially if they have any respiratory symptoms. And depending on that screening test, the patient can be managed by telemedicine, typically audio video. If a patient needs hospitalization, the Asante system has vigorous policies in place for PPE, and thus far have been able to keep staff in appropriate PPE in their facilities.
I know all healthcare workers, not just Josephine County, have been really struggling with the shortage of PPE, but I know donations are just starting to come in left and right. Are they doing better? Are they doing okay? How's PPE looking now?
PPE is in continual short supply. So that's the foundation. Because our case counts locally have been relatively low, the PPE that's available has been adequate. What we're all worried about is when case counts start to rise, if this chronic low supply is going to rise to meet the occasion, or if we're going to find ourselves in a tight spot. And to alleviate that tight spot, we don't know if more PPE will be coming in through donations or not.
You were mentioning earlier about telemedicine. Do you see people utilizing that for the most part? Is that, especially in general, is that something people are actually doing? Because I know a couple clinics, not here, but were saying that, you know, people aren't really using it that much. Are they utilizing it here?
They are utilizing it here. Practitioners are utilizing telemedicine here more and more. And I expect that as a result of this pandemic, that's going to be a more normal way of delivering health care.
One final question?
And this man, how long was he ill before he passed away? Did you guys talk with him? Did he, say how long that they were before they went to the hospital?
So his test was sampled on the 24th of March. He'd been ill for at least a few days prior to that.
So again, thank you very much for coming out. We'll wrap this up again. And I ask again, please, that everyone do what they can to respect the privacy of the family in this very difficult time. Thank you very much.